from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back to Daybreak. It's Wellness Wednesday, and today we're looking at a new study just out about the risk of heart attacks in younger smokers. Baptist Health cardiologist Dr. Scott Davis is always looking for reasons to help you quit or never start smoking in the first place, and he's here with that new research. Thanks for being here.
Morning.
You know, we think the warnings have been out there for a long time. Yep. No smoking, quit smoking, but it's still a very real problem.
Nobody lived longer smoking more of these. And so I tell this to patients all the time. I mean, you know, for all the emphasis that we put on, drug awareness and staying off of drugs, nicotine's probably the worst drug we have out there. And so some 16 million folks live with a disease related to smoking, whether it's lung disease, cancer, heart disease. 1 in 3 folks will have a cardiovascular death that's related to smoking. And so newer data has now come out from the British Medical Journal that has looked at the association between smoking and then heart attacks, a big heart attack that we'll talk about, in younger patients. So the way I describe heart attack's kind of like having a car wreck, okay? You can either have a fender bender in the parking lot or you can have a big old total out your car. There's a type of a heart attack called a STEMI, ST elevation MI, which is where you get changes on your EKG that are very troublesome, and it is really a big time heart attack. It's when you block off one of the main arteries to the heart. And so there is an 8-fold increase in heart attack risk with the 50 and under subset. So this study looked at heart attacks, about 1,800 heart attacks over the course of about a 3 to 4 year period in Great Britain, and they broke them down into age groups, less than 50, between 50 and 65, and then over 65. If you take all comers, there's about a 3-fold increase in heart attack risk in smokers versus non-smokers. But under the age of 50, it's an 8-fold increase, which is really, really sobering statistics.
So what do we do about this research, and how can it affect lives?
Right. So at the end of the day, we need to quit smoking. And that's easier said than done. If you ask anybody that's been a smoker, they'll tell you the hardest thing I ever did was quit smoking. So how do we transition to that? And I tell folks, look, there has to be some things that have to happen psychologically, because there's 2 components to smoking. One is that you're addicted to a drug, right? Nicotine is a real drug that we really have to focus on. But the second thing is there's a behavioral piece, and that is this hand-to-mouth thing that's happened over years, over decades, where the car won't start till I light a cigarette, lunch is not done till I light a cigarette, I can't sit down and get on the telephone till I light a cigarette. That part of it is where you've really got to get your mind right. Medicines like Chantix help curb the craving for the nicotine, but you're eventually going to have to do 2 things. One, you got to go home and throw them away. And number 2, you got to quit buying them. You know, nobody's putting a gun to your head making you go buy cigarettes. Now, once you reach that place, once you cross that bridge, you know, metaphysically, if you will, then you can look at the role of Chantix. But you've got to quit first, crutch second, not the other way around.
Good information, as always. Important research out there, always on top of it. Dr. Davis, thanks for being here. Yep. Baptist Health Helpline, there you go, 188-BAPTIST if you have any questions.